There's many flavors of dementia. Alzheimer's is one of them. Dementia is a broad category. It just means that there's a significant loss of cognitive functioning and a significant loss of functional capability.
Dementia is a bigger picture of memory disease severe enough to affect your day-to-day life. Alzheimer's is a type of that disease.
The longer we live, the more chances that somebody will develop dementia. And out of dementia, all dementias, dementia of Alzheimer type is one of the most common.
But there are other forms of memory disease, not necessarily Alzheimer's, like mini strokes or problems with certain vitamin levels.
I think the thing that everyone needs to realize about Alzheimer's disease is that the key risk factor is that you have a brain. And so we are all at risk for this disease, whether it is your parent, whether it is your grandparent, whether it's a beloved mentor, or whether it's you, but we're all at risk and we all need to be a part of the solution to this problem.
In 1965, we were both seniors in college, and we both went down to Daytona Beach, Florida for spring break. Met Marty on the beach, and he invited me to go out for dinner.
Greatest two-piece bathing suit I've ever seen in my life.
He had just finished playing his senior year at the University of Pittsburgh. He was an All-American. He had been drafted by the Buffalo Bills. He played for 6 years in the league, and then we had an opportunity to coach the New York Giants. I'll never forget, he came home and he said, you know, I really love coaching. You know the best part? They pay me American dollars to take care of my family by doing something that I'm good at and I love. And I thought, okay, this is where we belong. He always said it gave him great satisfaction to see players improve and get better and perform on the field. And he always thought it was a piece of him out there when he saw the players doing what they were supposed to be doing and having success. I personally am so proud of him. A week doesn't go by when somebody doesn't call and say, Coach, you don't know this, but you changed my life. He is so respected and so beloved by so many men in our profession. Life was busy, life was full. Then when the Alzheimer's reared its ugly head, things started to change. And then it was just very, very gradual. We always called him the Pathfinder. He could get us any place. All of a sudden, I noticed that he'd lost his sense of direction, which was always so acute, and then he couldn't remember where he was supposed to go, places we've been before. That kind of bothered me.
A major question for a lot of people is that, is what I'm experiencing part of normal aging, or is it something else?
What we have learned is that the disease starts much earlier than the symptoms. So people can live with changes of Alzheimer's for 5-10 years before they finally start not being able to compensate for memory loss and demonstrate issues in day-to-day life.
And in terms of symptoms, it usually manifests itself from difficulties with memory and concentration. Short-term memory is affected first. And then there is perception of time, ability to make complex decisions. Sometimes they have agitation and confusion, difficulties with the circadian rhythm. Patients sometimes feel more sleepy or sedated or groggy during the daytime, but wandering at nighttime.
Through the NFL, there was a doctor in California who was doing a study of 100 retired NFL players. And he spent time with all the other players and their wives individually, and he did a brain scan. When Marty and I went in, he said, I don't think you belong in this group. From what I see, you need a different kind of help. I don't want to diagnose, but you need to seek out a neurologist.
Most people that you run into have at least had some sort of experience with Alzheimer's disease in their family or a friend. So in our situation, it was my grandmother, and I wish we had better treatment options for her whenever she was alive.
My mother died from Alzheimer's, so I think my contribution here it has a personal touch to it as well. They actually were referred to a clinical trial which was no longer were accepting new patients. Before I had to discuss with them an opportunity to participate in a clinical trial, which was not back then actively enrolling or seeking patients, but I was very confident that we will be able to start doing that fairly soon. The basic principle of the trial is based on hypothesis that we can develop antibodies that can change specific fractions of beta amyloid protein. The beta amyloid protein is a toxic, fairly simple protein substance between 41 and 42 amino acids. And it has tendency to aggregate itself. It penetrates the blood-brain barrier and has tendency to create clots or amyloid plaques in the brain.
With the clinical trial currently going on with Dr. T, the drug is crenezumab, and the crenezumab actually addresses some of the specific peptides that are found in the amyloid plaques that are building up and causing the Alzheimer's disease. So that crenezumab can actually take those peptides and hopefully move them out of the brain to prevent those buildups and therefore the progression of Alzheimer's disease.
What we're trying to accomplish here is to change a trajectory of illness, making an assumption that as more amyloid we have in the brain, the worse progression of illness is.
We're trying to address the buildup of the amyloid plaques and really trying to prevent that to slow the progression. So I think that's how this trial is a little bit different than what we've seen in the past, and I think a lot of the research is focusing on that, and then also doing it in a way where the infusions are well tolerated for the patients so that they can continue getting the infusions on a frequent basis and hopefully slow the progression of the disease.
And so our role as radiologists is to interpret the scans that are done, whether it be an MRI or a PET scan or a CT scan, and follow our growing number of patients who are part of a research protocol for Alzheimer's disease. And that's where imaging biomarkers, things that we can objectively quantify or evaluate on a scan, are useful to determine the progression of the abnormalities in someone who's getting treatment compared to the progression of abnormalities in someone who's not getting treatment.
This is a double-blind placebo trial. So during 104 weeks, 50% of the patients will be receiving placebo and 50% of the patients will be receiving the active ingredient.
He is involved in a trial drug, a drug trial, I guess is a better way to put it, for Dr. T, and may not help him, may not be in time to help him, probably won't be in time to help him, but we're hopeful that it will help people in the future.
I think one of the most remarkable things is what I've heard from the clinical trial patients whenever they're asked, why did you decide to take part in this clinical trial? Even though they have the potential to benefit from that, most often we hear that they want to participate in the clinical trial to help future patients that may have this disease and give them the answers and better treatment options down the road. And I think that's a pretty honorable way to look at participation in clinical trials.
In the very beginning, Marty didn't want people to know. He's a very proud man, and it's very hard to put it out there. But quickly, as a couple, we learned the best way to handle it is to let people know that you have Alzheimer's. Once people know that you have Alzheimer's, they're much more comfortable talking with you, spending time with you.
The person with memory loss is still a person. They have emotions, needs, wants, which need and can be addressed. And when you are capable of doing that and keeping that person at the center of your attention, true miracles can happen.
Being a caregiver of an Alzheimer's patient has its highs and lows, like anything else in life. Unfortunately, it gets more difficult as time rolls along. When you've been with somebody 50 years and you know them so well, and when you're as fortunate as I am to have a partner who is a genuinely happy man, he's fun, loves to go out, enjoys people, we try to have as good a quality of life as we can.
I can say that they truly love each other. They do. You can tell he's so appreciative of all the care that she provides to him, and she obviously cares very much for him.
We're a good team.
She's my anchor. When things get tough, you can always count on her.
It's a true illness affecting whole family. So it's not just the disease of one person, it's a disease of the caregivers, loved ones, children. That's why so often the diagnosis itself and even medication will not provide that relief. What you need to do as a specialist taking care of person with memory loss, dementia, you need to be able to hear out and understand the caregivers. You will have to be able to prognosticate. You will have to be able to allow people to feel angry and abandoned.
Alzheimer's disease, I think, packs a unique 1-2 punch. It's not just the individual with the disease, but it is the caregiver, and in many cases, caregivers to that individual that are dramatically impacted. The data is staggering on how many caregivers actually develop diseases, potentially due to the stress of caregiving, and find themselves needing help and care during this, and they're not able to be there for their loved ones. So our goal is to try to wrap services around them to help them remember that in taking care of your loved one, you can only be the best caregiver if you are taking care of yourself.
It is not easy, and I know it's going to get more difficult. Silly as it sounds, I got my fists. I've got my kids. I've got my grandkids. I've got wonderful medical support. And we are very, very fortunate to have the medical support that we do here in Charlotte. I'm a very lucky lady.
Incurable does not mean untreatable. So there are things that we can do today to really change lives of patients with memory problems, Alzheimer's and dementia dramatically.
We're definitely moving in the right direction. I'm very confident on that.
This is an exciting time in the diagnosis and treatment of Alzheimer's. We're privileged here at Carolinas Healthcare System to have access to all of the latest technologies. Not only do we have tools that are better than ever before, it's specifically confirming the diagnosis and biomarkers through imaging that can follow progression of disease, but it obviously opens up the opportunity that in the not too distant future, I could envision the treatments being looked at in research now are commonplace treatments for patients afflicted with Alzheimer's.
There is a new vigor in that line of work based on advancements in clinical trials in the past 10 to 15 years. I think we will be able to come up with tangible results in the next decade.
We utilize humor. We utilize reality. We don't make a big deal about it. It's just who we are right now. And that's the best Marty and Pat can do. I don't want anybody to feel bad for us. I want people to appreciate what he's accomplished. I want people to appreciate how blessed we are with the family we have. I want people to know that life is good and we're going to take really good care of him. And whatever happens is going to happen, and we're going to be there, all of us.
I've never been one to indulge in self-pity. We have one basic philosophy in our home. Pick one foot up, put it on the ground. Pick the other foot up, put it on the ground. And that's how you get to where you're trying to go.